Well then, being one of the leading figures in the fight against COVID-19 is not for the faint-hearted. It's been a year since our first case, and Professor Salim Abdool Karim has been looking back at the arduous journey. eNCA's Dasen Thathiah has our report.
The 5th of March last year feels like, a whole world away. And I don't know if you feel like that, but it certainly feels like that to me.
I, for one, couldn't agree more. But Prof. Abdool Karim's journey has arguably been a lot more intense than yours and mine as ordinary South Africans. It all started with an alert he received while on holiday in January 2020.
This alert said that there were cases of an undiagnosed pneumonia in a place called Wuhan in China. And as the alert came in, I looked at it and I said, oh, it's nothing.
But that's not what he was saying a few weeks later.
By the end of January, the WHO declared a public health emergency of international concern. And that essentially told all of us we're now dealing with an imminent pandemic.
Prof. Abdool Karim and his team wasted no time.
We were testing patients who had a respiratory disease and fever. That's what we were doing, just looking in case they have the virus. And we weren't finding any. And of course, all that changed on the 5th of March. On the 5th of March, to me, and I'm not sure whether it was the same for all of you, but this epidemic became real.
South Africa moved quickly to implement a lockdown, which successfully delayed the peak, but information and evidence were limited.
So if you want to say, where's the evidence on how you impose lockdowns or ease lockdowns, didn't exist. No such thing. There are no. In fact, we don't even use the word lockdown in public health. It's a military concept. And it got borrowed and got applied in this particular instance.
The co-chair of the Ministerial Advisory Committee on COVID-19 says they had to sail the boat while building it.
Part of the problem we had was that initially, in April when I did the presentation, people began to see the role of science. And so the distinction between the two, between scientific advice and political decision-making, became complicated.
Prof. Abdool Karim admits things didn't always go to plan.
The COVID-19 response has had its errors. It had its problems, it had its abuses. From the abuse we saw in the military patrols, the Collins Khoza case, some of the irrational regulations that undermined confidence in government, the PPE corruption that just makes your skin crawl. We've seen these challenges. But I've also seen how South Africans can move mountains when we act together.
While the advisory committee has been focused on vaccines, there's been anxiety from some citizens about the wait. They wanted a miracle cure.
In the second wave, we had our new set of drugs, also drugs that work against parasites in ivermectin. I explained to you, it kills roundworms. It doesn't work against viruses at the doses at which you use, but people want their miracle drug.
Durban's St. Augustine's Hospital had an outbreak among healthcare workers last year. Prof. Abdool Karim was one of those sent there to find out more about the spread of the virus. A year later, it's where he has received his vaccination.
The vaccine is not 100% effective. No vaccine is. So you still have to protect yourself.
Dasen Thathiah in Durban.